Hello, I'm Dr. Adam London, Director of the Kent County Health Department. I hope you and your families enjoyed a wonderful Thanksgiving. We have a lot to be thankful for in public health, especially the fact that we have such a safe and effective COVID vaccine available for everyone 5 years of age and older. And wow, what a response we've seen from parents and those younger kids. We're closing in on 30% of that 5 to 11-year-old age group having received at least one dose. I want to thank you, and I want to also encourage all you parents out there. Please get your eligible children vaccinated as soon as possible. Doing so now will help to ensure that they have a strong immune response during the upcoming holidays and when school resumes in January. Getting eligible people vaccinated and boosters is the #1 most effective thing we can be doing right now to end this pandemic. Sadly, we have now lost 1,000 Kent County residents to COVID-19. We're still seeing many hundreds of new cases daily. Our local hospitals have well over 400 people hospitalized at this moment, and about 100 of them are in intensive care. Nearly all of those people were unvaccinated. I know you know by now, but this very effective vaccine is readily available at pharmacies, clinics, and health departments throughout the region. If you haven't done so already, please go to vaccinatewestmi.com and get vaccinated. Do it for yourself. But know that you're also doing your part to protect your loved ones, you're protecting our hospitals and our frontline workers, and you are doing your part to keep businesses and schools up and running. Now, speaking of schools, as you're aware, the public health order requiring facial coverings in pre-K through 6th grade expires before school resumes on January 3rd. This expiration trigger of 60 days post-vaccine eligibility for 5 to 11-year-olds was built into the order when it was issued back in August. I'm now receiving a number of inquiries about potential extensions of that order. Let me share with you some thoughts on that. Public health orders are extraordinary devices, authorized through state legislation for the most urgent of circumstances, when the public's health is threatened, for when public health experts have an exclusive and/or unique understanding of complicated information that other authorities can't yet act upon, and very importantly, when there are no other alternative solutions. It's my belief that orders are not really ideal mechanisms for extended policy when other bodies, especially elected bodies, have adequate time and information to make informed decisions about the overall well-being of their communities. It's these leaders and bodies that you, the people, have elected as your voice in this democratic society to weigh all the pros and cons of difficult decisions and make policy decisions. Furthermore, the reality is that our environment has changed a great deal in the past few months. A very effective and safe vaccine is now available for 5 to 11-year-old children. Vaccine appointments are readily available throughout the community. And importantly, other leaders, from school boards to legislatures, have had ample time, with awareness of the timeline and the relevant facts, to create longer-term policy for COVID mitigation as they see fit. I believe public health is most effective when we are providing the community with information, recommendations, and access to essential services. In general, public health agencies are also not well equipped to serve as enforcement agencies. Sometimes public health orders are needed, but that exercise of power should be as limited as possible in terms of time and in terms of requirements. At this important moment in the pandemic, the resources of KCHD are best deployed toward vaccination clinics, which provide direct protection against the virus, and in resuming the many other essential services which have been compromised during the past 2 years. Now, we will, of course, continue to provide recommendations about COVID risk reduction in much the same way as we offer recommendations intended to protect people from a litany of other public health concerns. We will not, however, extend the facial covering order in educational settings due to the many reasons I've mentioned. And of course, we will also continue to keep a close eye on new developments, such as the Omicron variant and new pharmaceuticals, and share that information with you in a timely way. Thank you once again for all that you do to make Kent County a healthier place for all.